are here on fourth Thursday with none other than Dr. Afflalo with IWC Primary Care and our community doctor who has kept us right and tight all these many years. Good evening to you, Dr. Afflalo.
Good evening, Dr. T.
Well, I tell you, I am excited about tonight. I've been telling people consistently, I really don't have too many issues because if I can't get to my primary care doctor, I could say, look, I could go and ask Doctor Follow. So, y'all, this show was a little bit selfish because some of the things that we talk about, I got questions about, and you probably got questions too. So tonight you can call in at 858-251-6111, 858-251-6111, and I'm going to kick it off because I got some questions and we're going to hop into the subject. But Dr. Follow is hot.
It's hot.
Lord Jesus, is hot. I need for you to tell us, how do we handle this heat and do it correctly so that we don't all pass out and meet our maker ahead of time? And when do we know that we are having heat stroke or any of the other strokes while this heat is going on?
First and foremost, I would say if on these hot days, if you can stay inside where it is actually air conditioned, that would be your first choice. Second choice is if you don't have air conditioning, you can certainly, there are some places in the community like libraries and other places that have cool zones. Find those in your community and go there and sit down and relax. Bring a book and read until it gets cooler in the evenings. Definitely stay hydrated, which means bring a lot of water and drink because you're going to lose. Some people sweat more than others. They'll lose their water from their body from sweating, and you have to put that in and probably a little bit of electrolytes. But definitely stay hydrated, stay out of the hot sun. So middle of the day is not the time to be jogging. I've seen people running up and down the street at 3 and 4 o'clock in the day or 10, and it's just ridiculous because it's like the hottest time in the day. So stay in cool spaces, stay in the air-conditioned spaces if you can, and then there are cool zones because it's going to get hotter. We're not even into the middle of our summer. We just started summer, so we're in for a treat.
Now, let me ask a question. Sunscreen. As a darker skinned African American, do I really need sunscreen or am I just prepared for the sun?
No, I mean, you have a little bit of protection, but you can still burn.
Okay.
I mean, you should put on sunscreen. I do when I go out there and I'm playing tennis. I put it on because, the ozone layers are not as protective. And definitely, if you don't want to put on sunscreen because it can be sticky or messy, wear some clothes or hat that is UV protected,
Yep.
so that the sun doesn't go through like the long. It's also very cool, so you can wear them long sleeves and a hat if you're going to go walking or something like that. But I put on sunscreen every time I go out so I don't burn.
Well, I just want to get you all prepared for the summer. We're still some of y'all trying to get your summer bod on. Well, we're in summer, so I think you're gonna have to get your fall bod on because we're already here. We're all working it out. But tonight, what is our topic?
Our topic is diabetes, just plain and simple diabetes and how we can either prevent it, control it, just do what we're supposed to do so that we don't develop the complications from diabetes.
Well, they want to say back in the old days, they said you got the sugar. So let's talk about it because, I heard that all my life, the sugar. Tell me about why did they call it the sugar?
Well, they call it the sugar because it's just that. There is everything that we eat breaks down into sugar. Sugar is our fuel. So just like you go to the gas station and put gas in your tank and it runs until you sputter down the road because you're running out of gas, the sugar is what we use as fuel. So when we eat, it breaks down into sugar and it's stored in our cells like closets so that when we need it, it can be open and we can use it. Comes into the bloodstream, provides the sugar that it needs into various organs so they can function. What happens with sugar or sugar diabetes is we have too much sugar in our bloodstream. We either don't have the proper insulin amount to store it because insulin helps us store the sugar into the compartments to like the closets or the cells, or our body doesn't recognize the insulin or it's ineffective. So what's happened is it stays in the bloodstream and then it starts causing damage to your arteries in various organs. And I'm talking about your eyes, your heart, your kidneys, your nerves. It can damage pretty much everything. If your body is bathing in sugar, it's going to start causing problems.
So my question is, if sugar is so toxic to our body, why do we even have sugar? What is the and then we have the substitutes, but now I'm hearing they cause cancer too. So tell me, what are we supposed to do to control the sugar?
Well, you've heard about moderation, right?
Uh-huh.
So drinking a liter of soda is not a moderation.
Okay.
So first of all, you really shouldn't be taking in any concentrated sugars,
Okay.
just period. It puts on weight, empty calories. So a soda or a juice, really, we don't recommend that. The three beverages we try to tell people to avoid are sodas,
Mm-hmm.
whether they're zero whatever, because they're obviously sweet, so they have some kind of sweetener in there.
Mm-hmm.
Artificial sweeteners are not good for you. So if you're going to get the regular one, it's full of sugar.
Mm-hmm.
The second thing is juices are full of sugar. I'd rather you eat the fruit than have the juice.
So you mean that juicing is not good?
Well, if you're going to juice, you can juice, but keep in mind, if you're going to get a glass, you've put in like 10 oranges. Or you
Okay.
put in a bunch of fruit to get juice. That's a lot of sugar.
Yeah.
If you eat one orange, you're going to have the fiber from the fruit, but you're also going to have the sugar and the juice. So it limits you the amount you're going to eat. One apple, one orange. But if you're juicing, you're going to put a lot of fruits in there, and you're going to have a ton of sugar. Like if you go to Jamba Juice, those calories are like 1,200 calories for a drink because it's full of sugar and the fruits and the ice cream and whatever else they put in it, right?
Okay, now, Doctor Follow, you hurting some people's feelings because they've been going to the juice shop and to Robux and the Jamba Juice and these little cute little bars, and they've been getting the juice. And they get a little green shot in it and everything else. And you mean to tell me that is doing damage to their system? It's not a healthy as drink as they want to portray it to be?
No, it's not. It's not that healthy. I mean, you can put all the boost you want in there, but you're just adding it to the amount of sugar in that smoothie or whatever it is. So the best thing to do is have it at home, or just don't do that because do they have calories next to that? Because if they do have it on the menu and they have all the different, mango madness or whatever, they should have calories next to it, 1,500 calories.
Okay, wait a minute, hold on. Now, why are you going to call out the drink I used to like to drink back in the day? That Mango Madness was something else, and that passion something.
Yes.
Oh, my goodness.
It's good.
But the funny thing about it, I have not been to a juice shop in about 10 years.
Good.
You know what I'm saying? And the reality was, as I said, I'm not paying all that money for you to squeeze some oranges and everything. I can do that at home.
Exactly.
So let's just talk about it. Let's talk about it. And I think that I want to talk about it not from the age that I'm at now. Let's start off with the children and what we can do with the starting our children off so that they're more likely not to fall into the diabetic situation.
Yeah. I think that's the best way to start. And obviously, parents are responsible for what the kids eat and drink. So if you don't go to the Costco's and Walmarts and buy cases of sodas and large juices, you put your children at a better chance of not having diabetes. If you keep their weight down, they won't develop type 2 diabetes at 10, right? Because I've seen kids 200 pounds at 10. That's ridiculous, right? So diet is important, and exercise. So get them off the TV and the computers and the whatevers, and get them out there to playing like they used to. Bring them to the park, or if the neighborhood's not safe, get them somewhere, put them in a sport, something. Stay active, eliminate the concentrated sugars, and a healthy diet. Those things will help. So if you can avoid the sodas, the juices, and the energy drinks that have sugar in them, because you go and work out for an hour, and then you have 2 Gatorades, and it's got sugar in it.
Yeah.
So you defeat the purpose.
So, and for those parents that say, I just can't get my children up off the couch to do that, my mother used to always say, and people used to always say back in the day, that we just going to give out whoopings on a general purpose because we know you done did something that we just don't know. So if you chase them around enough, they get enough exercise that they'll get on up, and just go and hand out some whoopings just because they done did something that you didn't know. But let me ask you this question. In this season, and this was the thing, I started asking the question, and this is not throwing any shade against any restaurant because I could go down the list. But I was wondering in my heart of hearts, why did Chick-fil-A seem to taste so good? So I had to go, and I said, I bet you they put sugar in their chicken. And lo and behold, when I went to go look at the ingredients and everything else, the chicken nuggets got like 9 grams of sugar. They got a lot of sugar in it. So is our addiction towards certain fast food based not on the taste, but because they put that drug called sugar in it?
Yeah, sugar and salt.
Yeah.
So you like the French fries, they're loaded with salt. So yes, those are the two ingredients that our taste buds tend to develop, and then we want it. When we have something without it, it doesn't taste right. So yes, there is an addiction for that, and they will add it in to keep you coming back. It's like crack.
Yeah.
Yeah.
So, so I'm gonna ask some questions because for all the folks out there that's trying to get around this sweet tooth thing. Now, what about agave?
Well, all of the sweeteners, I mean, honey and agave and all those, it is still sugar. It's a more natural form, and Splenda and things like that. So, stevia, I'm sorry. So what you can do is just use a small amount. So if you have your tea or your coffee or whatever you just, drink of choice to get you up in the morning, you can put a teaspoon of that in there, but understand that it has calories in it and grams of sugar in it. So that's fine as long as you limit it. But if you put 4 tablespoons or something in there, then you're really doing yourself an injustice because you've added too much sugar in there. So I'm not saying don't use it. Agave's fine, honey is fine. Brown raw sugar is okay, just in moderation, so a small amount. And there's no recommended amount that you should have and shouldn't have, but we kind of use a gauge of like 5 grams of sugar, which is nothing. 5 grams of sugar for a woman and 6 grams for a man, that's nothing. That's like, a teaspoon. So,
So with the first basis, and this is one thing I love about my granddaughter, she loves water. You ask what she wants to drink, give me water. So here's the thing. Is it that we should start off with children, water, 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 and make sure that they have a craving for water before they have a craving for the juices and the this and the that?
yes. Yes, absolutely. If you can push water at all times, our body's made of water, 70% water. It's not made of Gatorade or apple juice or whatever. So water is definitely best. And if some people don't like water, you can put something in it to flavor it. You can cut up an orange or a lime or lemon or mint in it or whatever you want to do, cucumber. You can flavor your water so it tastes better for you, but really just water is the best drink possible. And some people will give their children a soda or juice, but they'll water it down, like maybe half and half. Yeah, but don't do that every day because that's still sugar. And they'll get addicted to that flavor. So as much as you can avoid it, that would be great.
Now, I'll tell you, that infused water, I used to think it was one of those bougie things, oh, that's so pretty, you get a little flavor in. But that infused water could literally lower some of the caloric intake for those that are used to having flavor, but all these sweeteners on top of it.
Yeah.
Just a hint to say, that tastes better.
Yeah.
So let's break down diabetes. Let's start off, because I keep on hearing, if you have type 2 diabetes, if if there's type 2, is there 3, 4, and 5?
No.
And so I'm going to ask that question. Then I'm going to talk about this weight loss thing that people are doing that I'm still concerned about.
Okay, well, let's just start off with the basics. There's basically 3 types of diabetes. There's type 1. That tends to occur in childhood or teen years, and it really is that the pancreas just doesn't make insulin. So at some point or another, they don't have insulin. Insulin, you need it in order to allow the sugars to be moved out of the body, out of the bloodstream, into the cells. If you don't have insulin, you will die. So you need insulin, and if your body stops making it, they start having side effects to the point when they go in there, they'll see their doctor, they'll do the proper blood test, and they'll be diagnosed. At that point, they are now going to be placed on insulin for the rest of their life.
Okay, so wait a minute. So type 1 diabetes is saying that your pancreas, so you need your pancreas, makes insulin.
Yes.
And if your pancreas stop working, then you got to go on insulin.
Yeah, and if you don't have insulin, right.
Okay.
Exactly. So, and then type 2, we used to call it adult onset, but that's not true because we have children with type 2 diabetes. So it's no longer really restricted to an age. It's more of management of weight and diet. So you can develop type 2 diabetes at an earlier age. Probably like some 10 and 12-year-olds have it, where we might not find a type 1 until maybe 15. So you can get type 2 before you even develop type 1. So type 1 is completely different. Insulin is not there. They need insulin. Type 2, the insulin, either it's by weight management or diet where the sugar is just too much in the system, they need to, number one, and it's usually weight related and diet related. So if it's especially in a child, we definitely need to get them on a more restricted lower sugar diet, exercise, and hopefully not need to put them on too much meds. Type 2, we normally don't start them on insulin. We start them on oral or tablets, medications, no matter what age. And a lot of times over time, if you're not doing the right things, not eating properly, not exercising, keeping your weight down, you can then require 2 and sometimes 3 oral medications. You can even require insulin because you just need enough to allow the insulin that's in your body to be recognized, do what it needs to do to move the sugar out of your bloodstream into the storage areas.
So my question is, as an adult, say for instance, I'm 59 years old, can I get type 1 diabetes? I can only get type 2.
Yeah, it's
So-
unlikely type 1 at that age.
So why do they make type 2 diabetes and type 1 diabetes like you can get them both?
Well, you can, but they're not specifying when.
Okay.
So most of the time, adults, you're 30, 40, 50. I've never seen anyone. It's pretty unlikely unless you have a pancreatic issue and then your pancreas shuts down and you no longer develop insulin, then that's an issue. But that's not normally the case at that age. An adult onset is usually a type 2, and then we need oral medications will do the job.
All right, so adults, please understand. Don't say, well, I only got type 2 diabetes. I don't got type 1, because if you didn't have it when you was a kid, 9 times out of 10, you're not going to get it as an adult. So when you get type 2 diabetes, you got the sugar.
Yes.
Okay, so let's talk about it. What do we do? Say, for instance, they got pre-diabetic, on the verge of being diabetic. How can you turn it around? And can you turn it around when you get type 2 diabetes? Can you turn it around and go back to no diabetes?
Yes, you can.
Okay.
It really is related to your lifestyle. So if you can do some lifestyle changes, adjust your diet, do what your provider recommends, get some weight down, those types of things, you can. So the only way we can diagnose you with diabetes is if we do a blood test an A1C, hemoglobin A1C, that tells you that number is elevated, and there's a range. So anything below 5.7 or whatever, 5.6 is considered, normal. So 4s and low 5s. 5.7 to 6.4 is considered pre-diabetic. And then anything past 6.5 is considered diabetic. Now, 6.5 doesn't mean you have to go on medication at that point. It means that you need to pay attention, and now you really need to change your diet and exercise, because at this point you run the risk of having more damage to the organs.
Yeah.
Pre-diabetic is your warning. Get your act together before you become a diabetic and get labeled.
And, I want to say, I try to do labs every quarter just to check out where I'm at and everything else of that nature. And my doctor personally gets on my nerves because I see that you have not been in full workout this quarter. And I'm like, don't be reading me like that. Yes, we're going to need to get those 4 days in to 5 days a week. You're not bad, but your numbers saying that you're not doing it. And so it's important, and I think that this is the key thing. It's important to get your labs. Now,
Yes.
Doc, this would hurt my feelings. I got to a certain age, Doc, and I said, every year I'm going to go in and get my physical. And do you not know what the doctors told me? And you helped me out with this, because, I'm going to ask Dr. Afflalo. They said, well, how we do physicals now is we do labs. And the labs will tell us if we need to do more. So is that true that I don't get poked in pride no more to get my physical running upstairs and anything? Is this all about the labs?
Well, the labs are important because the labs tell you what your organs are doing inside. So that's key. You should have everyone should have baseline labs every year to compare to the previous ones. But they've done things differently. Back in the Stone Age days when I started, was in medicine, we did a full exam. Looked in your ears, in your throat, checked your eyes, all that stuff. Feel your neck, see if there's any lymph nodes that's enlarged. Listen to your heart and lungs, poke on your belly. Do a rectal exam at a certain age if we need to. Do a vaginal exam for pap smears, yes. Less likely now. Most physicians are cutting the corners, and you'll be lucky if you get listen to a heart and a lungs, if you see their stethoscope. I still do pretty much full exams. I just think it's important because if they're complaining about they can't hear, how am I going to know unless I look in their ears and see that it's packed with wax?
Yeah.
The minute I take that out, they can hear again magically. If their throats bother them, or how do we find lymphoma? If their lymph nodes are swollen and they're persistently swollen and no one's coming in, we need to know that. So it's important for your physician or your provider to lay hands on you so that they can know what's going on.
On speaking, lay hands on you. I like that. I'm put next time I go to the doctor, I'm like, say, look, I need my physician to lay hands on me in the anointed way to make sure that I'm okay. So why is it that we're seeing diabetes on a big onslaught among African Americans and among the poor.
Yeah. Well, I mean, think about it. When you go to the grocery store, the things that you see that's on sale are, top ramen or something, 10 for $1. So we're eating things that are salty. We're seeing drinks that are on sale. When you go to the drive-through and you're already eating bad food, you buy a soda. You can, add $1 and you get a big, a big drink. That's just what they're promoting now. And so if you learn to just stay on the perimeters of the store, don't go in the inside aisles, and you'll have your fresh fruits and veggies and maybe milk or whatever, those types of things is healthier. But I'm sorry, they're promoting you to eat more foods. And if you watch the commercials, you get the big drinks, or you can, when they used to say supersize it or whatever. So a regular drink is not enough. You got to get that big, humongous drink.
See, that's when we know when you was on a date and you be like, oh, girl, go on, supersize that. You thought you was big shot, but you were actually causing some harm. So you made a statement. You said, stay on the perimeter of the stores. Let's talk about that a little bit.
So when you go into the grocery stores, most of the things down the middle of the aisles are processed. They're in cans, they're in packages, things like that. The only way for them to have a shelf life is to have something in them to make them last longer. Things on the outside, if you stay on the outside, you're going to have all your fruits and veggies around there, your produce, your meats, things like that, eggs, butter, those types of things. They're going to be on the periphery. So if you stay on the outside and barely go on the inside, you will have a better option of picking healthier things for your family.
All right. So a patient comes in. They're smiling, hey, Dr. Afflalo, and you do the labs, and you got to break the news to them. Break the news to them, and then what are their next steps? After they cry, like, no, I don't got the sugar, not the sugar, Lord Jesus, the sugar.
Well, I mean, it's not the end of the world.
Okay.
You have an opportunity to correct that problem. And so what you need to do now is time to pay attention. I've been warning you along the way, but now you finally have reached a threshold where you're labeled a diabetic. You don't have to stay that way. Now we need to change your diet. I need you to start exercising. All you need to do is 150 minutes a week. Break that up how you want to, and stay active. I need you to get the weight down. So it might be like 30 minutes 5 times a week or something.
I was doing it in my head.
Yeah.
That 2 hours is 120 minutes, and so that's about 2.5 hours, and you're good to go.
Yeah, and you can break it up.
Okay.
Yeah, it doesn't have to be every day. It can be a little bit more, twice a week, whatever that looks like. But the more you exercise, the more you burn calories, the more you can manage the weight, and that's part of it. If they do the right thing and we now look at their numbers, we follow their numbers closely every month, every 2 months, it starts coming down, which motivates them to continue doing the right thing. And then if it doesn't seem to budge, regardless of what they're doing, we should discuss medications. I won't necessarily start them on medications unless they're really high, giving them an opportunity to decrease the toxicity of their blood with all that sugar in it and damaging to their organs over time. And if we need to, then we can certainly taper off the medications once they get their life together. So if they're like a 6.8 to a 7, I'll still give them an opportunity to do diet and exercise, lifestyle changes. I think it's important to a lot of patients to do that. If they come in with a 12, and we have seen that at the health fair, and I'll talk about that, we have diagnosed uncontrolled diabetes that people didn't even know they had at a hemoglobin A1C of 12. I told you that 6.5 is considered diabetic. That's twice normal. So twice so they are out of control. And then they're wondering, why did they lose weight and they didn't try? Why are they getting a little bit of blurred vision? Why are they urinating more, or they're feeling thirsty? They're having symptoms, but they're not paying attention to it. Some people don't get symptoms, but most people will start having symptoms that their sugar is too high. And so that's when you need to go in and say, hey, something's not right. This is what's happening. Why don't you check it? We'll check a random sugar in an A1C. We'll diagnose you, and then we'll start recommendations. If it's as high as 12, I'm going to start them on insulin, and then start them on oral medications until we get the numbers down into a safer range. And then we can, talk about, once they get them down into something manageable, we'll dial down certain medications. And if they get back to a normal range, I'll start dialing down the medicines. And if they stay normal and not pop back up into over 6.5, then I can actually just let them do lifestyle change only.
So let me ask you a question. There's Sister Naomi in the feed said, is it true that diabetic 2s can't eat any type of sugar, or can we cheat every once in a while?
You can cheat, but there's consequences.
Okay.
So you're going to eat sugar. There's sugar in everything. So if you're going to have a fruit, it's got sugar in it. You know, if you eat a slice of bread, it breaks down into sugar. You can't avoid sugar, but we want you to avoid concentrated sugars like cookies, cakes, pies, ice cream. So I will say if you're going to...
You better stop cussing at the people. She said cookies, cakes, pies, and ice cream. You saying no peach cobbler a la mode? What?
No, that too. All of that.
Okay.
Yeah, all of that. When you start adding the white sugar and the brown sugar to it, all of that. But what I can say is if you're going to a celebration of some sort, you don't need to deny yourself. Just have a thin slice of it. Mm-hmm. You can enjoy it. But you can't have 4 scoops of ice cream on top of that, or you can't have a big wedge of cake. You need to be sensible because all you're doing is making your life more difficult if you do that. But I'm not having you deny it. I'm just saying, you know, there are consequences to your action when you eat.
You know, Fred Price used to say that I love vanilla Swiss almond. So I had to basically shun vanilla Swiss almond because you just couldn't take just one little bite because it come in a little pint and before you know it, the pint's gone. And so he said that he had that same situation and he had a refrigerator in his closet. Mm-mm. And he said that he had to learn to go in there when he wanted some vanilla Swiss almond. He got him 1 spoonful and he would take it, he would eat it, and then he would shut the refrigerator. He said he had to tell himself, don't you go back.
Yeah.
Don't you go back. So he got that taste that he wanted, but he didn't overly indulge.
And you can do that. Mm-hmm. You can do that.
So let me ask, you know, I got tons of questions about this because I see this all the time. So I'm going to give you the things I want to deal with. I want to deal with blood sugar going up and down, 1. I want to deal with synthetic insulin versus human insulin, if they still do that. And then I want to talk about these different apparatuses of sticking your finger, not sticking your finger, it's on your phone, all of those things.
Oh, goodness. I hope I can remember all that.
I'm going to remember it for you.
Okay.
So the first one I want to do, the blood sugar going up and down, and people saying they're in crisis or they're having they need insulin or they got to put a piece of candy in their mouth. Tell me about that and what is that all tied to?
Well, it's probably not a type 2 diabetic unless they're on a certain type of medication. But insulin can cause you to go up and down, right? So if you're not an insulin-dependent diabetic, you probably will have less problems with that. So insulin-dependent diabetics or people that have insulin, if you take a rapid or fast-acting insulin, you need to eat at that time. You need to inject and eat. You cannot inject a rapid or fast-acting insulin and then hang around for 2 hours. You will bottom out, and they'll find you on the ground somewhere.
Okay, so talk about what's bottom out and what is taking place with your body.
Your sugar, what's happened is the insulin has stored all your sugar. Now you have nothing. So your sugar drops from whatever it was, 200 down to like 30. And you pretty much, you pass out. You don't have any insulin, you don't have any sugar to function off of. So if people start feeling shaky and weak or whatever, some people do that when even if they're not diabetic, because they haven't eaten in a long time, they start feeling shaky and weak. You need to eat because your body needs fuel. So the diabetic, if you're on a fast-acting insulin, you cannot skip your meal at that point. Now, if you're on a long-acting insulin, it kicks in about 8. It peaks in about 8 hours. It kicks in about 4 hours. So you can take like a long MPH insulin at bedtime, and nobody eats at bedtime, and it works. It makes your sugars low in the morning. But if you're taking a regular insulin, fast-acting insulin, you need to inject and eat before breakfast. So we tell you to check your sugars before each meal and to do the appropriate. You might be on long-acting NPH, but if you check your sugars before your meal and it's 300, you're going to take your NPH maybe 50 units, but you need to take some regular insulin, which is fast-acting, to get that 300 down. So people that are on insulin, it's been described to them what they need to do, how to manage their sliding scale insulin. That means you can slide your regular insulin up or down depending on your blood sugar. Right? But if you're on long-acting, that's less of a concern. You can just check your sugar twice a day to make sure it's not dropping. But your body should let you know because you start feeling shaky. And I tell people to travel with some sugar tablets or a little bit of a mint or something that they can pop in and make their sugar.
Pentecostal mints, they work
one of
really
those.
well. Yeah. So let me ask you a question. I remember back in the day, because I have family members that had diabetes, where they had to do the syringe, and like my mother, she could only use human insulin versus synthetic insulin. And they had to prick their finger and everything else. Now they seem to have gotten it down where you don't have to prick your finger no more. They can put this little thing on you. You can get your phone and your phone's going to tell you where your blood sugar is. Let's talk about the evolution of the technology where even you're dialing pins versus doing all the other stuff. Let's talk about that.
Yeah. So some people still do that. They still have their vials of insulin, the clear and the cloudy, as some of our patients call it, or the long acting, short acting, and they still need to do the drawing up of their units, number of units that they take, because it varies. We do have some mixed insulin that's 70/30. That's kind of a short acting, long acting together. And then we do have the pens that have the insulin in it. You just dial the number of units that you need or whatever, and then you inject. So a little bit more sophisticated where you don't have to draw it up, but you can dial in what you need and inject. Then you have the continuous monitoring where you have a device that you put on, usually on the back of your arm, and then you just and it reads. It reads constantly, so that if you're out exercising and you need to know what, if you need to eat, or if you're really burning off a lot of calories and you're not sure how low you are and you need another half an hour or more of workout or whatever you're doing, you need to check your sugar and make sure you don't need to snack in between or something like that. Those are definitely more convenient, but not all insurances cover that, continuous monitoring.
Okay. So a lot of technology has taken place over the years. What are we knowing today that we didn't know, say, 20 years ago?
Oh, goodness. Probably just how serious diabetes is. Back then, people didn't take it that serious. I think, and even the providers probably didn't instruct their patients to be more diligent about it. But it's causing too much, especially in the African American and Latino populations, too much kidney failure. Where every dialysis unit has mostly people of color in there.
Okay.
And amputations and strokes and heart attacks.
Hold up, wait a minute. We were just talking about the pancreas, and now you done got to the kidneys and everything else. Okay, so let's talk about the outcome, because you done hit folks with a lot, because they was just worried about their pancreas when we first started off. But now you're talking about dialysis and everything else. So break this down for us, because people need to know this.
Okay, so I told you that the sugar needs to be stored. Your blood sugar should not be, your arteries should not be bathing and swimming around with sugar in it. So if it's not stored properly, you have high sugar levels. If it stays high, uncontrolled, you're not on meds, you're not on insulin or whatever to store it, it's going to start, that sugar in your bloodstream is going to start damaging the end organs, the organs where the arteries go to. So the heart, the key ones are heart, obviously going up to the brain, to the eyes, to the kidneys, to the nerve endings. I mean, everything has blood vessels going to it, right? And if all this sugar is going to these, you get damage. So to the heart, you're at a much higher risk of heart attack. So diabetics are equivalent to heart patients, okay? They are at high risk for heart attacks. Strokes, believe it or not, blindness. You keep having that sugar bathing around your optic nerve and in your arteries to your optic nerve and artery, you can go blind. Kidneys, that's one of the leading causes of problems, disability. You're going to start having chronic renal disease, and it continues until, if you don't do anything about it, you'll have CKD3, chronic disease stage 3, stage 4, stage 5, end-stage renal disease, until you finally, you need to go on dialysis. They'll put that stent in your arm, and then you'll just go on there 3 times a week. They'll see you at the dialysis unit. Or you can do dialysis at home every day for, 12, 14 hours. It impacts your life and traveling and everything. And then nerve endings. So people, diabetics, a lot of times, and not all diabetics get it, and not all people with neuropathy have diabetes, but peripheral neuropathy, where you have numbness and tingling, burning sensation in your feet, especially your feet and hands, the nerve endings, you'll have that complication. And after a while, when you just burnt out all those nerves, you can't feel anything in your feet. Yeah. Shame on you if you walk around barefoot and have a nail or something in there and you don't look at your feet. Then you get an infection and get gangrene, and then we got to chop off the toe, then the foot, then the ankle, then below the knee, then above the knee. We just keep chopping, right? We don't see that much chopping with white folks, but definitely people of color. We just don't pay attention and take good control of things and pay attention to the warnings that after a while we just start, because it damages the blood vessels where you have poor circulation. So now you don't have good blood supply going down there, and the nerve endings are gone, and then we have to start chopping, because you're going to either lose your life or lose a limb.
Well, I tell you, this segment is being brought to you by IWC Primary Care. I want to tell you the go-to people in our communities to serve us with the truth. Now, I know y'all have some truth, and I know everybody's going to their refrigerator right now, throwing the ice cream down the drain, throwing out all the sodas and the juices. Y'all got a big old glass of water trying to flush your system out right now. But I want you to know that this is a lifestyle change. And you know, Dr. Follow, back in the day when I was younger and everything like that, I would have a cup of coffee in the morning. And it had the artificial sweetener in it, it had the cream in it. And I would wake up and every morning have a cup of coffee, maybe have two or three during the day. But there came a time where all that stuff used to start making me sick.
Mm-hmm.
And all I could drink coffee is black.
Mm-hmm.
And I never thought black coffee would be good.
Mm-hmm.
But man, I tell you, when you turn 59 years old, black coffee just tastes so delicious now. And you feel much better because you don't have all those extra things in it.
Yeah.
So one of the things I think people want to understand is a lot of times we think of diabetes with people that are overweight or have this or have that. But what about those people that are thin, seem like they're in shape, but they're suffering from diabetes?
Yeah. Diabetes doesn't look for someone with a size of weight or whatever. It tends to run through families. So there's probably predisposition for family members. And I'll give you an example. At one of the health fairs, there was a young lady that we did her A1C. It was 12.2. Mm-hmm. She didn't even know it. But she had like 12 family members and about 8 of them. I think she had 8 siblings and aunts and uncles and stuff. About 6 of her 8 siblings had diabetes. Mm-hmm. So she was thin. Yeah. She was like 130 pounds, maybe 5'5" or something like that. So she was a normal size. You wouldn't look at her and know diabetes. So you would think that she would be paying attention to it. Mm-hmm. And so, I had to immediately put her on insulin and that sort of thing. So it's not the size. And then I have patients that are heavy set, even obese, and they don't have diabetes.
Yeah.
So go figure, right?
Yeah.
But so you can't judge a book by its cover. You just have to you need to know your numbers and you need to do the labs. The A1C is going to be the true definition of whether or not you have diabetes or pre-diabetes.
Now, I know that we say African Americans and Latinos have a high number of diabetes, but one of the things I think that, and the reason why I wanted to do this show, is we see it even at a higher realm in the church community, where we see more health issues in the church community. And honestly, I think that we feel when you grow up in the church, everything that we go through, we're going to pray about
Mm-hmm.
it. And God's going to deliver us.
Mm-hmm.
You know what I'm saying? But as our pastors and our leaders begin to be more astute about prayer changes things and the power of prayer can change things, they also said we have to start giving our congregants the right information, and we're not going to do a fish fry every Friday to build the church or whatever. We're going to have walkathons. We're going to do some different things to activate our congregation so they'll be here longer.
Exactly. And the problem is when we went to church, it was surrounded by food. You'd have donuts in the morning, and you'd have something after the meat, especially if you spent the whole day there. And it was always bad. It was fried chicken. It was potato salad. It was all kinds of stuff and then juices. I didn't think there was any bottles of water anywhere. Mm-hmm. So the choices
with
that
flavor,
they gave
Kool-Aid.
you, Kool-Aid,
Red.
with flavor red. And so they set themselves up and their parishioners up to be unhealthy. Mm-hmm. And yeah, unfortunately, praying about it is fine, but the Lord gave us a good sense and decisions. And if you know that you're not supposed to eat and drink certain things, why are you praying about it when He's giving you knowledge to do better? Mm-hmm. So you can pray all you want to, but you're still going to have the diabetes, and then we're going to be scheduling you for your dialysis and your amputations.
Okay. So now I'm going to get on to this whole weight loss thing. What is it? Agabi? Well, what's
Ozempic?
It's Ozempic and another one that's out there that people are taking, and they don't have diabetes.
Oh, yeah. Wegovy or something like that.
Something like that.
Yeah.
So, but this is supposed to be medicine centered around diabetes and helping with diabetes, but now people are taking it for weight loss. I'm concerned because it's just like getting the gastric bypass. I have not met one person that's gotten gastric bypass that has kept the weight off. and most of the time I see them bigger.
Mm-hmm.
You know, the sleeve.
Mm-hmm.
I haven't seen one person that don't get bigger. And here's the thing, and this is something that I always ask: if they require you to lose 35 pounds before they allow you to get to surgery, if you could lose 35 pounds before they give you surgery, then why don't you take another and get to lose 75 pounds and not put your body through the trauma?
Mm-hmm. Well, you have a good point there. So, unfortunately, the key to the reason why most people that you've seen are not successful with keeping the weight off is because they did not do the lifestyle change. You have to stick to the lifestyle change. And that's why, at least I know when I was at Kaiser, you had to go through almost a year program of counseling and mind changes and how you look at things and how you go to food. And if food is your crutch, then we need to figure out another way how to have you handle your stress and things people eat. You know, some people don't eat and, lose weight, and some people eat. It just depends on how you manage stress and how you do certain things. So
Yes.
that's part of the problem.
And honestly, I preached a message about my addiction. And I went through the whole thing about, my addiction was so strong, it would wake me up in the middle of the night, and I would have to feed that addiction. And everybody said, oh, my God. He was addicted, and they thought of everything that I could be addicted to. And then I said fried chicken, and everybody laughed. I said, no, that is the one addiction many times in the church that is acceptable, and that is gluttony or overeating or using it. Some people use food just like any other drug. Bad day, have a steak.
Yeah.
Somebody stressed you out, get some ice cream.
Yeah.
And once we start looking at it for what it really is meeting that same need of maybe that drug addict or that person that's going to get a drink. And it's addiction that we have to then control so that we don't then let it consume us.
Right.
So my question as we go forth, I'm saying all of these things that are coming out, and what I said greatly concerned me was people taking the medicine to lose weight. But I hear that there are side effects for taking the medicine on heart and everything else. And the minute you stop taking the medicine, if your lifestyle hasn't changed, you're just going to go right back up.
Absolutely. And so it's the same thing for everything. If you don't do the lifestyle change, you're not going to be able to control your diabetes or your weight or your whatever, your blood pressure. So it's all about the mindset changing, because all of these are quick fixes. So all these medications that they're using for weight loss and the surgeries, it's all a quick fix because they're either frustrated, they don't know how to stick to it, they don't have discipline, whatever it is. If you cannot stop, if you don't know how to manage your stress and things like that a different way, which means counseling, getting different tools, different skill sets to manage your stress and all the other things you go to your drug of choice to do, which is food or beverages, then you'll never be able to succeed. So you do need that program to help you not turn to those things. But yes, there are drugs out there, injectable drugs, Ozempic and Wegovy or whatever it is called, that one is approved. There's similar drugs. One is approved, FDA approved it's supposed to be for diabetes control, and some of it does help with preventing cardiac problems, heart attacks. But the Wegovy is the one that has been FDA approved for weight loss. So if hopefully they're in a program or with a provider when they're giving it, that they're also counseling them on the need to have lifestyle changes, or they're going to lose the 50 pounds, 100 pounds, whatever it is. And the minute they stop it, if they're still going back to driving through and picking up unhealthy things or drinking the sodas and eating ice cream when they're stressed, they're going to gain the weight back.
Yeah.
And yes, medications have side effects. Everything has a side effect. Tylenol, aspirin, everything. It's just depending on, do you want to take that the rest of your life when really all you need to do is just manage how you eat and just stay active? So we just have to do better as a people of making better choices and not going for the quick fix.
Yeah. And I think one of the things that is so important is also talking about it and asking the questions, because I believe that a lot of people think, well, I didn't have the praline and cream, I just had regular vanilla. And they think that because it didn't have all the other stuff, it wasn't a chunky monkey, it was just vanilla bean, and they're not realizing that it's still having the same effect. They might as well get a scoop of chunky monkey because it's going to have the same effect.
It's sugar.
And I think that there's a lot of misinformation that is given out, and I know that that's why a lot of times we think that we're doing things that are healthy that aren't healthy. Remember, Jamba Juice was considered to be healthy. Oh, go get a Jamba Juice. You know what I'm saying? And you're like, okay, now we're starting to see Jamba Juice got a ton of calories. Why am I gaining more weight
Yes.
while I'm eating, while I'm just
Yes.
having juice, but I'm still gaining weight because of the caloric intake?
Yes.
You know, so I think that it's so important that we continue to ask questions and continue to do our research and not be afraid of the results, but then respond in a way to change the results.
Yeah, you can't stick your head in the sand. You need to know it. Some people just don't want to know. And that's all well and good, but then be ready for the consequences 2 years, 5 years, 10 years later. I don't want to have to tell you I told you so. But the point is that if they're serious about their health, they'll start making changes, small, incremental changes. I can tell you that sometimes when I just counsel people, I say, just stop the sodas. In about a week, they've lost 5 pounds because
Yeah.
they were drinking all those extra empty calories. You know, or if you're having 5, 6 beers after you come home and you're wondering why you got a beer belly, stop drinking them. You'll see that belly starts going down. All those empty calories. So if they can, and then smoothies. Even some people that are healthy and they're making smoothies at home, the problem is that they're putting a lot of fruit in it. So I told this one gentleman that I ran into over at Senior Center last week. He said, "Oh, Doc, I listened to you and things are so much better." I asked him, "What are you putting in your protein shakes?" And it was a ton of like 4 or 5 fruits, had some spinach or some kale, had a protein, scoop of protein and all that, all well and good. But, he couldn't lose the weight and da-da-da. I said, well, you know what? What you really need to do is there needs to be more greens in there, more kale and spinach, and 1 fruit to season it or to flavor it, right? So an apple or an orange or something like that. Because you want to have a little bit of flavor, put your protein scoop in there. So once you change the calculation of how much you put in, more greens, less fruit, it became healthier, right? So not 5 fruits and 1 green, but more 5 greens and 1 fruit. And then you get all what you need but not that extra sugar.
Okay, can I say I used to cheat? I would pile in the greens, and then what I would do, I'll do the water, and I like mine cold, so I threw ice in it. But you know what my secret weapon was? It was like candy. I would put in a date.
Oh, no, that's good. One date?
One date.
Yeah, that's fine.
And you can't, and it don't ever really chop
No,
up. So
no.
when you sip it, you get a little piece of
little
candy.
pieces of, yeah.
You're like, oh my goodness.
Yeah.
This is. So I was, we're learning different ways that we can make things enjoyable. To the point that even on the radio, they were like, where's your green drink? Where's your green drink? And they used to always see me drinking green drinks. So this is really, really good stuff for diabetes, for people to change around. So what I'm hearing you say, that being, I'm going to say pronounced or diagnosed as a diabetic doesn't have to be a lifetime sentence.
Absolutely not. And if you don't have diabetes now, so you don't ever have to get it, especially if you're prone to it because of either weight or family history, you can take action right now. If you know there's things in your diet that can come out, start teasing them out, or cutting them down less, and increasing the activity, and pick your activity of choice. It doesn't have to be anything, torturous. It can be fun.
Hello, because, y'all keep on saying, Dr. Afflalo looks amazing, but you hear her say she played tennis.
Yes.
And tennis is not a 1-hour game.
No.
In tennis, you could be out there 3 hours, so she could get 1 tennis season in and knock it out for the week. Some of you guys like to bowl. Some of you guys like to walk. There are other things that married couples, there's just so much you can do to keep your, start burning off calories. Some folks like to jump rope.
Yes.
Some folks they got skating rings and they go skating. There's just so many different things. And what I like, and this don't mean for anybody who has, I'm not a dog lover, but if you got to walk your dog every day, the dog is walking you too.
Yes.
But don't you go home and say that Dr. T said, I need a dog, because that's between you and your household. Don't do it. Dr. Afflalo, this has been some great information, but I got to ask some more questions. You got a health fair coming up, and this is going to be a big one. Let's talk about it.
So yes, of course, the community knows that we have a monthly health fair from February to December. It's the first Wednesday of every month. It's from 10 to 3. But July and August, we add on something special during the health fair, and that is free sports physicals for our youth, because they all want to play football, cheerleading, whatever that is, track. And it's hard for the families to find an extra $150 to get a sports physical or to even get an appointment with their provider. So, we have, and I can send you the information, but we have a QR code that people can sign up to get a sports physical free. It's going to be at the Jackie Robinson YMCA. Most likely it'll be in the community room with sectioned off so that we can have some privacy for some of the things that we need to do for some of the sports. But yes, we'll have the health fair on the parking lot, and we'll have the sports physicals hopefully in the community room, and it's free. Just sign up for an appointment. If you walk in and there's a lot of people waiting, you may just have to wait, right? Appointments are going to be honored first. If there's no one waiting and you've walked in, we're going to slip you in. So that's both for July 3rd and August 7th.
All right, so parents and communities, don't sleep on this. This is free sports physicals. They can't play unless they have their physical. And Dr. Afflalo said we do good physicals. We just don't go over there. She said she's gonna lay hands so that she'll know that your child is okay to get out there. Now, before we go on with that, there's a question and thing said, what is a good tool to prevent bad breath when you change your eating habits?
Well, bad breath can come from a few places. It can come from your oral cavity if it's not good, if you don't have good hygiene in the oral cavity, meaning
is that your
mouth, your teeth, your gums. So if you're not flossing and you're not brushing regularly and using a little bit of Listerine or whatever choice you use, then bacteria lives in our mouth. So at some point it's going to be,
you can have a yuck mouth.
A yuck mouth.
Yeah, okay.
But it can also come from your stomach, from your gut.
Okay.
So depending on what you eat, you can exude, what's coming from your tummy. So I would just say, you can certainly get those little things that kind of floss your teeth during the day if you are, and get a little swish of something in the middle of the day. It's hard until you either make sure that, go to the dentist to make sure that the oral cavity is fine. You don't have gingivitis and other things with little pockets of bacteria hiding around. And then just make sure that you're eating properly. Sometimes you just can't avoid it. You just have to go ahead. And nasal nasal activities, when you have postnasal drip, sometimes that can cause some breath and odor problems. So just check out all the cavities and make sure they're working. Cavities, not teeth cavities, but, cavities like your sinuses, your oral cavity, your stomach, to make sure they're all in check.
So I'm going to ask this question because I think it's a hustle, but I'm just going to ask the question. Activia. They say that Activia gives you the right probiotics and everything, but Activia is expensive. Is there another brand or something that's out there that can help you regulate your probiotics better than Activia?
Yeah, they have them in tablets and capsules. You just go to the store where they have all the vitamins, and you can look on that, and they have probiotics and things like that there. You don't have to eat your yogurt with the things in it. You don't have to spend that much money.
So you're saying that there's a more cost-effective way, but it's still as effective, maybe even more effective than Activia?
Yeah, you can, and they have thousands, meaning, certain amount of thousands of active bacteria or whatever it is that you get in your probiotics. And so you can look on the labels and just figure out what you want and give it a try. It's just like popping a vitamin, just pop one of those.
And that won't hurt your system or cause you to go into any panic or anything like that or have any issues?
No, it usually helps with your digestive system. That's why the probiotics are there. So it usually helps your digestive system. I don't take them, but if you feel like you need them, go for it.
So what is the purpose of probiotics?
Well, I think some people, if they have a digestive issue, that helps. If they, I know an older lady I was taking care of, she needed it to help with, she'd have indigestion and heartburn and all that stuff, and depending on what she eat or didn't eat. But it does help with a digestive disorder. Everyone doesn't need it. They promote a lot of stuff to us, and they want us to buy everything. By the time you take the 30 tablets in your mouth, you're not hungry anymore. So, but I would say, unless somebody recommends it, I don't think it's necessary. For women who are prone to yeast infections and some other things, sometimes we'll tell you to get on probiotics if you're taking an antibiotic to avoid yeast infections. There's several reasons to take it. I personally don't see a reason for me to take it, so I just don't.
All right. I'm going to ask this because, we're trying to get this all in because people want to know what's going on with COVID because we just had a COVID scare in our organization. And my thing is that it keep popping up, but it's not popping up at a rate that everybody's nervous about it anymore. What's going on with COVID? Are people just ignoring it, or they have it, they just don't know they have it?
Well, both. COVID never left.
Okay.
It never left. It continues to mutate. It's just that a lot of people did get vaccinated, so they're kind of protected. They may have very minimal symptoms. They may not have any symptoms. So if you don't have any symptoms, you don't test, but you can still spread, right? So if you don't know you have something, but you're still in, close distance in people's personal space, you can certainly pass it along. As we start getting closer to the winter months, or start coming in closer contact, and the virus starts spreading more, we're going to have more of what we had before. Not a pandemic, but we will start having an increase in it. So, continue if people want to get their vaccines. I think I've had about 7 or 8 by now.
Mm-hmm.
So, and God forbid I have not even had, COVID, and I test regularly.
Mm-hmm.
When my allergies flare up, I test to make sure I don't have COVID. But, it's really about protecting yourself. And also, the minute you have a symptom, because we do trigger it for allergies, because it's allergy season with things blooming and fires happening with dust in the air. But just test, because you may have COVID, which means you should wear a mask or stay away from somebody, or get Paxlovid so you don't, if you have any underlying conditions, you don't get really sick. So there's still Paxlovid treatment out there. But wear a mask, stay indoors for about 5 days, retest, and then go back out there. Wear a mask in close quarters. So it's never gone away, and it probably isn't, but it's probably gotten to the point where it's not as aggressive, and because we have some herd immunity of a lot of people getting vaccinated, and it's going to be like the flu, where we're at some point we probably will need a vaccine every year to just keep it at bay. We're just not there yet. So the seniors, like myself, they're recommending, at least, I think that we had the new one in September. Then somewhere in January, February, they recommended we got another one, and I think I just got one recently. So when they recommended 60 and over and people with underlying disease, I just go and get it, so that I don't, if I do happen to catch it, I don't get anything severe.
Well, I mean, we've had a great conversation. Let's end off with IWC primary care. Let's talk about what's new, what's on the horizon. Any new staff that has come in? I know that you guys are packed to the rafters. Is there another clinic coming? Another franchise spinning off? Did you guys come up with new product? What's going on?
Well, we continue to grow, which is a blessing. Be careful what you wish for, because God will, see it through. So we are growing. We have a lot of new agents, insurance agents, that are helping us enroll people and letting them know that we're out there. We're getting a lot of Medicare patients. And so, it's a blessing. We did add a new staff member, a medical assistant. She's amazing. She speaks Spanish. She's got a lot of experience. And we're now doing blood draws in the clinic, so we don't have to send everyone out to the lab. Depending on your insurance, we can draw your blood right there. Okay. The other thing, too, is I don't think people are aware, and we probably didn't mention it at the time, when we opened up maybe a few months later, we got something called Patient Point. And that is a big screen. It's, I don't know, it's pretty big. And it's in each one of our exam rooms, and it's an integrative thing. So you can actually and the patients we can show them how to use it. So when they're sitting there waiting for us, they can look up information on what is diabetes, heart disease, what about my knee, it hurts, why does it hurt? We also use that tool to help show and explain things, so a show and tell. And it has a lot of information on it about vaccines, everything on there. So it's such an amazing tool. And I don't know if any other clinic that has it, but it's called Patient Point. And it's probably about 3 feet tall and maybe about 18 feet wide. And it's a device that's in every room that people can just play on it and do it's a touch screen, so they can have fun and learn a lot in there.
So basically what you're saying is that you entertain them while they're waiting, and they be so enthralled, they forget that they wait. I love that. It's like going to a dentist's office and you lay back and there's a TV on the ceiling, and so while they working on you, just watching your favorite TV program or listening to your favorite music, and it makes the experience so much enjoyable. Well, I want to say congratulations to you all again. IWC Primary Care is doing an amazing job. The clinic every first Wednesday of the month at the Jackie Robinson YMCA is just not just for the health, but it's for the complete body. They have food out there. They have all these different resources that are out there, so you don't want to miss it. And parents, let's get our children not only vaccinated, but let's get them with their physicals. They want to play. Don't disappoint the children. Hit up IWC. Well, can they go to IWC?
Yeah, we can put the link on there, or the QR code on there. We can put that on there so they can go and find it and just sign up. All they have to do is scan the QR code and pick an appointment time.
And then send it to us also. We're going to put it out so that people can see and know that they can go and scan it right there off one of our apps or whatever, and be able to be a part of it.
Okay.
Well, Dr. Afflalo, I know that we got more to talk about, but we have ended our time.
Oh my goodness.
So this is from Ask Dr. Afflalo right here on GODRadio1.com. Y'all be blessed.